Hello, welcome to this class on understanding temporary disability or TD. I'm Dr. Sandler. I'm a psychologist. I'm a QME as well. That being said, all this information is meant as general information. You should always consult with your attorney. Regardless of any information you hear in these presentations, you should always check with your legal representation to see if they apply to you and how these things apply to you. For those doing this class in FRP, please feel free to pause as we go through this presentation, maybe as the slides change, take any questions or any discussion as we go through the presentation. Understanding temporary disability. Understanding the benefits available to you during your workers' compensation claim is crucial for your recovery. The basics of temporary disability: if your injury prevents you from working, you might be eligible for temporary disability or TD benefits. So, temporary disability is a benefit of the workers' compensation system when you're injured and you're unable to work fully. TD benefits are intended to replace a portion of your lost wages while you recover. It's very important to understand that temporary disability is not meant to be forever, it is temporary, and it's in the context of while you recover. You're expected to be undergoing medical treatment and proactively trying to get better during this time. There's two types of TD or temporary disability. There is total or partial. So you might be placed on temporary total disability, TTD, or temporary partial disability, TPD. TTD is a little bit more common. It's a total temporary disability. Total means you are not working at all. So the definition of TTD is TTD benefits are provided when you are completely unable to work due to your injury. You are not working at all. In other words, you are working 0 hours in any capacity. To be eligible, you must be unable to perform your job duties as a result of your injury. You're not able to work at all. The amount is typically for total temporary disability is about 2/3 of your average weekly earnings. So if you take your weekly earnings, you take about 66% of that, or 2/3, that is about how much you'll receive for total temporary disability. I should mention that TD benefits are not taxed in the same way as regular income. So although it is 2/3 of your earnings, it may even out a little bit due to these temporary disability benefits not being taxed. There's total temporary disability, and then there is partial temporary disability. Someone with temporary partial disability benefits is when you can do some work duties, but not all at the same capacity before your injury. So if you are working only a few hours, you are probably eligible for partial temporary disability. In terms of eligibility, you must be able to work in a limited capacity, but earning less than before your injury. So you're likely not making your full wages, you're not full duty, and therefore eligible for partial disability. The amount temporary partial disability benefits help make up for the wages you lose if you can only work part-time due to your injury. They cover 2/3 of the difference between what you earned before your injury and what you earn now. So with total temporary disability, you get 2/3 of your entire wage. With partial temporary disability, you get 2/3 of however much you've lost, basically. So let's look at an example. Imagine before the injury, you worked 40 hours per week. After the injury, now you can only work 20 hours per week. Therefore, 40 hours was your regular duty minus 20 means you've lost 20 hours of wages. Right? You're only working 20, you worked 40 before. That means you've lost 20 hours of that income from those hours you're not working anymore. So the partial temporary disability benefits would be paid out on the 20 hours. So you would get 2/3 of the wages you lose from the 20 hours you're no longer able to work. How does temporary disability interact with job restrictions? Temporary disability benefits are closely tied to your ability to work and any restrictions placed by your healthcare provider. Your doctor may place restrictions on the type of work you can do. These restrictions are meant to prevent further injury and facilitate recovery. So many of you, probably all of you in FRP at least, have various restrictions placed by doctors, and these are meant to protect you, but at the same time, that means your employer may not be able to accommodate you with those restrictions or limitations. So modified work or light duty, if your employer can accommodate those restrictions with modified or light duty work, you may return to work in a limited capacity. If you work fewer hours than you did before your injury, you might be eligible for that temporary partial disability benefit. Like I said, sometimes there is no suitable work due to the nature of your restrictions. If your employer cannot accommodate your restrictions at all, they'll say there's no work for you, and that may make you eligible to receive temporary total disability or TTD benefits. Temporary disability does not last forever. There are many different reasons why temporary disability will end, and no matter what the reason, it will end at some point. It is always temporary. Temporary disability benefits are designed to support you during your recovery. They're not indefinite. You are not expected to recover for the rest of your life. And in fact, there's a very specific time period for temporary disability. Again, temporary disability is always temporary. Here are the primary reasons those benefits will end. The most obvious reason temporary disability will end is you've returned to work in full duty. If you're able to return to your regular job or an accommodated position, your benefits will cease. The entire purpose of temporary disability is to provide lost wages while you recover. If you've recovered and you're working, logically, there's no reason to receive temporary disability. The second reason you'll stop receiving temporary disability is you have been declared permanent and stationary or maximal medical improvement, P&S or MMI. When your doctor determines you've reached P&S or MMI, that means your condition has stabilized or plateaued and is no longer likely to improve any further, and therefore your benefits will stop. If you've seen the life of the claim class, then you'll know that everyone progresses through certain stages and eventually is declared P&S. When you're declared P&S, your progress has plateaued, you're not expected to recover. And since TD is while you recover, then if you're declared P&S and not going to recover, you are not eligible for temporary disability anymore. There's also a 2-year limit. Even if you're not declared P&S, even if you're not offered work, TD benefits have a maximum duration of 2 years. After the 2-year period, benefits will end regardless of your status, of how well you feel or how badly you feel. Temporary disability does not last forever, even if you don't have a job to return to. So there is a maximum amount. The fourth reason that your temporary disability will be stopped is non-compliance. If you fail to comply with treatment, like you don't show up or you refuse it, then that can result in the termination of your temporary disability benefits. Again, if you are refusing treatment, you are not actively recovering. And since temporary disability is while you recover, it makes sense that they will stop your benefits if you're not complying with treatment, if you're not going to treatment. Finally, if you refuse an offer of your employer trying to accommodate you with work, your benefits may be discontinued because you've been offered work, you've recovered sufficiently to do that work that they're offering you, so the benefits will cease. In no case is temporary disability a replacement for a healthy body. While those benefits provide financial support, and you do deserve that financial support, they're not a replacement for having a healthy, functioning body. Your overall goal is to recover and to return to work and other productive activities. It's very important that you are active in your own recovery. The workers' compensation system expects you to be actively involved in your recovery. This means attending all appointments, following treatment plans, participating in therapies, and proactively following up, proactively doing your exercises, doing the things you're learning on your own, and trying to become more independent. You're not simply waiting around for other people to fix you. You have to set goals and you have to try to achieve them. Set goals that focus on improving your ability to perform work-related tasks or daily activities. So if there's a lot of lifting at your job, you need to set goals to increase your lifting strength, increase your mobility, your lifting, your ability to stand or sit. These are important goals, and you need to have actionable plans to achieve those goals. We establish goals to enhance our quality of life, including managing pain effectively, improving nutrition, returning to hobbies you enjoy. You can set goals around any of these topics. I encourage you to be proactive and self-reliant. Recovery from a workplace injury requires you to actively participate and be proactive. You can't sit around and wait for other people to fix you. You have to take action. It's important to try to stay motivated and self-reliant during this process. Try tracking your progress. Keep a journal of your recovery milestones and achievements. Every week, maybe set new goals. See if you met your goals last week, set new ones this week. It can help you see the progress you're making and stay motivated. Remember that you have to celebrate your small wins. All the big victories are made up of a lot of small victories. So celebrate those small victories in your recovery journey. Each step forward is progress toward regaining your health and returning to work. You're not in this alone, so seek support. Engage with support groups, with friends, with family, with healthcare providers. Ask people what resources are available. Share your experiences and challenges, and that can help provide support and encouragement from others. Taking charge of your recovery empowers you to make informed decisions and take responsibility for your health. Don't waste your time on temporary disability. Developing self reliance fosters a sense of independence and confidence, which are crucial for your overall well being and a return to a productive life. You don't develop self reliance by waiting around for other people to fix you. You need to take proactive steps to recover and get back to life, get back to work. The purpose of temporary disability is not to replace your job, it's not to replace your healthy body. Do not waste time when you're on temporary disability. You must put all of your effort into setting goals, actively recovering, and returning to work. So just some discussion questions if feel appropriate. The first one is, how do you move past the frustration of not receiving your full wages to focus on recovery? Many people get stuck on this idea that they're not getting paid their full wages, frustrated, resentful at the injustice. How do you focus on getting better rather than getting wrapped up in that frustration? Number two, can you describe a time when celebrating a small win in your recovery journey helped boost your motivation? It can be hard to recognize small victories, but when we do, it can often make us feel more motivated, realize we are making progress. Number three, how do you stay motivated and proactive in your recovery while receiving TD benefits? Many people, they start receiving temporary disability and it's about the same after taxes as what they were getting before. People can lose motivation to get better because they feel like they're financially stable. Remember, TD is temporary, so how do you stay motivated to be proactive in your recovery? Number four, overall, how can you take a more proactive and less passive role in your recovery? How can you take a bigger part in your recovery rather than relying on others? Thank you for joining me for this class. I'll see you next time.